Good afternoon. Welcome back to the OBG class. So in our previous classes, we have studied about the types of the means of bones pelvis we have seen. So in the pelvis bones, we have seen the pelvis bone is made up of 4 bones, that is 2 innominate bones, ilium and ischium. So we have in depth, we have seen with the bones, okay? So which are the various landmarks in the bones also. Okay. Then we have seen with the ligaments of the pelvis, which are the ligaments in the pelvis. Then after completion of the ligaments, now we are moving on towards the next topic, that is on the pelvic joints. Okay. So we are going to see about the introduction about the pelvis, then joints of the pelvis, and we'll see the learning outcome, and we'll have an exercise and the reference. So the objectives of the class will be the student will be able to understand and explain about the pelvis and about the joints of the pelvis. Next. So pelvic joints. There are 4 pelvic joints. That is 2 sacroiliac joints, 1 symphysis pubis joint, and 1 sacropoccygeal joint. So how many joints are there? There are totally 4 joints. 2 sacroiliac joints, 1 symphysis pubis joint, and 1 sacropoccygeal joint. Okay. Now let us see in depth about this 4 joints. There are these 4 joints. Now speaking about the 2 sacroiliac joints. Okay. Now the name is indicated. What is the name says? Sacroiliac joint. Means the joint is present between where? From the sacrum and the ilium. Okay. So the where the sacrum promontory is there and where the attachment of the iliac bone, that is the ilium bone, is there. There we are saying it as a sacroiliac joint. In our previous class, we have seen the landmark, that is the sacroiliac joint, or you can just means after that ala or we have seen it. So that is the sacroiliac joint. And these two joints, okay, they are slightly movable joints, and they are formed when ilium joints the first 2 sacral vertebrae on the either side. Means the fusion of 5 bones is the sacrum. So of that 5 bones, 2 sacrum bones are getting fused with the ilium, and they are forming what? In sacroiliac joint. Okay, and they are connecting the spine to the pelvis, and these are the strongest joints in the body. These sacroiliac joints are the very strong joints of the body because they are connected. You just imagine the pelvis bone is here, the joint is being here, the whole spine is being attached here at the lower end, that is the sacrum is getting attached, and it is bearing the whole body's weight. So they are the strongest joints in the body. Then there is one pubic joint, that is the symphysis pubic joint. Okay. So the symphysis pubic joint, where is this? The symphysis pubic joint. Okay, where the ilium, okay, the complete ilium and the ischium. Okay, just below the ischium front you can see there are 2 rami, that is the superior rami and the inferior rami are there. So these superior rami and inferior rami to come, they are coming together and they are joining in front. Okay, there is a pad of the cartilage, and there the pad of the cartilage is where we see it as what? the symphysis joint. So it is a cartilaginous joint between the two pubic bones. In between these two, where our hand is resting and on the side, in between these two bones, the joint which is taking place in front, that is near the symphysis pubis, we are calling it as what? Symphysis pubis joint. Okay. So now the next joint is the sacropoccygeal joint. Okay. So where is the sacropoccygeal joint now? The name. Okay. You just see the name. Sacrum or coccyx. That is the sacropoccygeal joint. The joint which is formed between the sacrum and the coccyx. We say it as what? Sacropoccygeal joint. And that joint is between where? From the sacrum and the coccyx. Okay. So in between the sacrum and the coccyx together are what they are being fused. Okay. The sacrum 5 bones and the coccyx 4 bones fused together. So they are forming the joint there. Okay. Hinge joint means they are the togetherly only they have taken place. Okay. Coccyx, if you see, means very small bones are there. Lastly, it will come, and the coccyx is somewhat a movable one. Okay. During the process of labor also. There they are forming a joint that we are calling it as what? Sacropoccygeal joint, and that is the hinge joint. And it is also slightly movable during the process of labor. So next coming to the pelvic ligaments. Okay. So what are ligaments now? Ligaments are nothing but when the pelvic bones are getting held together. Means all the bones of the pelvis are held together by what? With the help of the ligaments. Okay. So how many types of ligaments we are having? We are having the number one, that is the sacroiliac ligament. Okay. So name is that sacroiliac ligament. Okay. From where to where it is? That is from the sacrum to the iliac. So that is why it is sacroiliac ligament. Okay. So from where to where this sacroiliac ligament is there? This sacroiliac ligament, that is, it passes in front and behind the sacroiliac joint. Means this ligament is passing from the frontal aspect and the back aspect of where the sacroiliac joint. In the sacro and iliac joint. So from the front aspect also it is there, and from the back aspect it is there. So the sacrum and iliac, they are held together by which ligament? That is the sacroiliac ligament. So the next is the pubic ligament. Okay. So the pubic ligament, where I already told you, GNM and GNM put together with the help of the cartilage, they are joining here with the help of this cartilage. So this is the pubic ligament. So the pubic ligament, what is happening? It is connecting the pubic bones. Two pubic bones are connected. These are all both separate bones. So with the help of this ligament only, what is happening? They are connecting. Okay, in between cartilage is there, this bone and this bone is joined with the help of a ligament. That ligament we are calling it as what? A pubic ligament. Okay. Next, we have the sacrotuberous ligament. Okay. Now name use. Sacrotuberous ligament. Now which is sacrum now? Sacrum is the upper part where the pelvis. Okay. Tuberous. Tuberous means what? Tuberosity. Our body is resting where we are sitting on that. We are sitting on the tuberosity, the hardest part of the pelvis. Okay, so on that harder part of the pelvis, when we are resting, that is the ischial tuberous. There lies the sacrotuberous ligament. Means from the sacrum to the tuberosity, ischial tuberosity. One ligament on each side. They are running from the sacrum to the ischial tuberosity. They are said to be sacrotuberous ligament. So now the next ligament is the sacrospinous ligament. Okay. Again, you see the name sacrospinous. I have already told you the station of the head is determined by the help of ischial spines. Okay. In ischial spines, the station we say it as 0. Above we say it as minus station and below the plus station and it is minus station. Okay. So what is there? The spine is there. So the spine also there from the sacrum to the spine also ligaments are there. From one on each side. Two spines are there, so two ligaments. From the sacrum to the ischial spine, from the sacrum to the ischial. We say them as what? Sacrospinous ligament. Okay. And the last joint, that is a sacropoccygeal ligament. In the sacrum and the pockets, they are also held together on themselves. So one ligament on each side of the sacrum pocket on the left side and on the right side. So that is the sacropoccygeal ligament. So now we are having the ligaments we have seen in the pectoral area. You can just see here your one mark is the iliolumbar ligament. Means from the ilium to the lumbar there the ligament is attached. That's why it is the iliolumbar ligament. You can see here posterior aspect, that is the front and behind ligaments were running, that is the sacroiliac ligament. Okay. And we do have the sacrospinous ligament. You can see there also. So what is there? There is a sacrospinous ligament is also there. Okay. So this is the sacrospinous ligament. Next comes is the sacrotuberous ligament, which is the tuberosity. From the sacrum to the tuberosity is there. This is what is we are calling it as what? Sacrotuberous ligament. Okay. So these are the ligaments, that is the bones and the ligaments. Posterior view of the backside view of the pelvis. Just revise this. Okay. So what all we have seen here in this class, so we have seen about the bones, which is the joints of the pelvis, and as well as the ligaments of the pelvis. So we have seen that how many joints are there? There are total 4 joints. That is the sacroiliac joints are there. Okay, and one pubic joint is there, and one sacropoccygeal joint is there. Okay, see, two sacroiliac joints. The sacroiliac joints, they are how where are they present? Okay, they are present just and the sacrum. They are joining. Okay, the first 2 cervical vertebrae are there. The sacrum vertebra there they are getting adjoined on both the sides. So there we form the formation of the joint is there. That what we are calling it as a sacrum joint. Okay, and this is a slightly movable joint. And then they are connecting the spine and the pelvis, and these are the strongest joints in the body. That was about the sacroiliac. Then we saw the symphysis pubis joint. One symphysis pubis joint is there where the both the sides, the symphysis pubis is coming and they are getting joined. The superior rami and the inferior rami is there, so they together come and join and they make one joint. That joint we are calling it as what? Symphysis pubis joint. So the next is the sacrococcygeal joint. So what happens in the sacrococcygeal joint? Sacrococcygeal joint means it is a hinge joint, means they are fused together. The sacrum and the coccyx all together, what they are getting fused together and they are forming a joint. That joint we are calling it as a sacrococcygeal joint. Then we have also seen the pelvic ligaments also. So pelvic ligaments, how many ligaments do you have? We have again around 5 ligaments. These are the main important. So what are ligaments? Ligaments are they are holding all the pelvic bones together. Okay, so those we are calling it as what ligaments. So how many? The first is the sacroiliac ligament. What is the sacroiliac ligament? As the name it is telling, sacroiliac. So from where to where? From the sacrum, okay, that is to the iliac. There is both front side and the back side. They are running. So they are called as what? Sacroiliac ligament. So they are from the front aspect and back aspect also they are getting joined. Okay. Then the second joint was the pubic ligament. Okay. So where pubic ligament, where the pubic bones are getting joined. So there, what is there? A ligament is there. Means two pubic bones are being held together by the joints. That is called as the pubic ligament. Then is the sacrotuberous ligament. What is the sacrotuberous ligament? Which one ligament on each side are there? They are running from the sacrum to the ischial pubis. So we are calling them as what? Sacrotuberous ligament. Then comes the sacrospinous ligament. That is one ligament on each side of the sacrum and the ischial spine. They are the sacrospinous. From the spine to the sacrum or sacrum to the spine on both the sides, they are then. So they are sacrospinous ligament. And the last one we have is the sacrococcygeal ligament from the sacrum to the coccyx and the both the sides we are having the ligament. So that is what is the sacrococcygeal ligament. So we have seen, and even in the anterior or the posterior aspect also we have seen there is a iliolumbar ligament which is held in place, means from the ilium to the lumbar also like that iliolumbar ligament. Okay, and the posterior view of the pelvis. Okay, so that's all ends with the pelvic ligaments and the joints. So the exercise for the class is you have to explain the joints, all the joints, and also you have to explain about the ligaments. So the learning outcome which we have achieved, and we will explain about the bones of the pelvis and the students. The effective learning outcome is after the end of the class. What outcome we need, outcome we have achieved now. Again, we have applied the concept of the topic into the technology. Means whatever anatomically we have learned, we are been applying it into our technology. Then we are now able to have a critical and innovative thinking where we can identify which are the landmarks, which are the bones, which are the joints, and which are the ligaments. Then this will help us to retain us with a long learning ability. Then we have the ability to observe and develop a sense of and the logical skills for abstract concepts. Can we have the ability to collaborate and then we will lifelong learning. There are some of the references. The better book I would refer to can is about DC Datta or the Annamajiko. Okay, so there also you will find it. Meet in the next class. Diameters of pelvis. Okay. I will end my topic here and kindly answer all the. Thank you.